My name is Dr. Stephen Warnock, and I'm a plastic surgeon. The procedures that I do most often are centered around breast and body contouring, tummy tucks and liposuction, breast implants, breast lifts. I would say I do 3 tummy tucks a week and maybe 5 breast surgeries a week. And then rhinoplasty is maybe 1 a week. And so that adds up. That's a lot of experience. We have a surgical center that is accredited. And that means somebody aside from us comes through and makes sure that we do everything right there. Hospitals go through the same process, but office-based surgical centers often don't. And so that's something I think that sets us apart from other groups, perhaps. We would prefer to just give people the best result and the best possible safety. I would say some questions that I get very often. First, are you board certified? I'm a board certified plastic surgeon by the American Board of Plastic Surgery. That means that I've been trained and held to a very high standard for safety and for professionalism. So that's something I take very seriously. The second is how much time do I need to take off work? And of course it's different for every procedure. So breast augmentation, if we're just putting implants in, it's about an hour, I would say, to do that procedure. And most people would take 3 or 4 days off work and then be able to get back to it after that. A breast lift at the same time takes a little bit longer, both in surgery and in recovery. But they're both very well tolerated and people bounce back pretty quickly. Every patient has their specific needs, and that's part of where the listening comes in. We will talk for a little while and I'll try to understand exactly what they're trying to get. It doesn't serve me to give someone a look that they didn't want or that makes me happy, because my goal is to make them happy. So we're going to talk for a long time about exactly what they want, and everybody's a little different. It's interesting. I have a lot of patients who are like, if I'm going to do this, I want to swing for the fence and I want a big difference. And then others are just like, I would rather not have anybody notice. I want my patients to feel comfortable knowing that we're putting their needs and concerns first. When we're addressing confidence, we want to address those things that bother you the most. So that's, I think people come away with a really profound improvement in their confidence, especially if we've listened and we've addressed what bothers them. Well, we have a great staff. It's a large team that we have, and we've assembled them very carefully so that the patient experience is as good as it can be. I think we have a really good way of connecting with patients so that they feel comfortable talking to us about their problems, first of all. Talking with the nurses, they become friends with the nurses. They become friends with me.